When you think of oral health, what comes to mind? White, straight teeth, brushing after meals, regular flossing. All of these things are necessary for good oral health, but it goes much beyond just the basics. The mouth is not separated from the body, and oftentimes traumatic injuries to the face can affect more than just a person's appearance.
Facial and jaw abnormalities cause a host of problems for patients. First of all, functional chewing, which what we call mastication, can be very difficult if patients have difficulty with their teeth coming together. Second of all, aside from function, and really maybe the most important concern for a lot of patients is the cosmetic result and facial profile that they have, even that causes some psychological disturbances throughout growth and maturation. So really it's both a functional and a cosmetic oriented stance.
Oral and maxillofacial surgeons like Dr. Andrew Hilley and Dr. Brent Henriksen do much more than just extract teeth. They are specifically trained to evaluate and provide treatment for those sustaining many forms of facial trauma, or those with oral diseases or other craniofacial abnormalities.
Most residencies and most oral and maxillofacial surgeons will train the oral and maxillofacial surgeon in simple dentoalveolar surgery, which is tooth extractions, dental implants, preparing the mouth for dentures, preparing the mouth for implants. We also will treat temporomandibular joint disorders, either non-surgically or surgically. Trauma, basically of the maxillofacial skeleton as well as the mandible. So car accidents, sporting accidents, things like that.
Today at Sanford Hospital in Sioux Falls, South Dakota, they are performing corrective jaw surgery on a patient.
The patient that we saw today had a very, very large underbite. She's been in interventional type orthodontics where she had her teeth straightened as a youngster, and then she's been in some holding wires and so on and so forth, and then after her permanent dentition came in, when her growth was done, then it would be my job to address the skeletal component of her problem, which was the lower jaw was out way too far and the upper jaw too far back.
She's 16 and she's just having problems biting, chewing down on some food. The bottom jaw comes out farther than the upper, so then it's hard to actually bite down and then to chew the food. He also said there was only a couple teeth that were actually connecting, so it's hard for her to chew and then to bite.
Corrective jaw surgery corrects major dental and skeletal abnormalities. It includes the correction of misaligned upper and lower jaws and teeth, and sometimes the chin, which will improve speaking, chewing, and breathing.
For some reason or another, the jaw will either grow too much or the jaw will grow not enough. And when that happens, the teeth will try to compensate for that malocclusion, and so then you'll get some tooth malposition as well as the skeletal malposition, which both have to be addressed together in order to achieve that maximum result, optimal result.
At their practice, River Ridge Oral and Maxillofacial Surgical Center in Sioux Falls, South Dakota, Drs. Hilley and Henriksen are continuously updating their surgical techniques so that the procedures are state-of-the-art and minimally invasive, thus serving the best interest of the patient.
At River Ridge Oral and Maxillofacial Surgical Center, we perform full-scope oral and maxillofacial surgery. We perform really a multitude of procedures, anywhere from reconstructive surgery, trauma surgery, placement of dental implants, extraction of wisdom teeth, intravenous general anesthetic procedures, cosmetic procedures. It's a really large scope practice.
Dr. Brent Henriksen performed a facial surgery for me. What he did was he pulled my upper jaw out and down a little bit and put my lower jaw back in further because I had an underbite at the time, and it corrected my facial profile as well as gave me a functional ability to eat as well.
69% of adults ages 35 to 44 have lost at least one permanent tooth as a result of an accident, gum disease, a failed root canal, or tooth decay. Although you have a number of restorative options for the treatment of missing teeth, none have proven to be as functionally effective and durable as dental implants.
A dental implant is generally a titanium metal, at least a titanium coated implant, and really it's almost like a screw that goes into the patient's native bone or grafted bone, and the implant serves really as a root structure in order to help attach to a crown to benefit the patient long term, both in terms of function, chewing function, and cosmetics.
The surgeons and staff of River Ridge Oral and Maxillofacial Surgical Center are committed to serving their patients with the highest standard of care. From the initial consultation to the last follow-up visit, every step is taken to ensure that each patient is treated with respect and professionalism. Serving the communities of Sioux Falls as well as eastern South Dakota, southwest Minnesota, and northwest Iowa, River Ridge Oral and Maxillofacial Surgical Center. To learn more, call today or visit riverridgeoralsurgery.com.